Hi everyone, my name is Natalia. I'm from Brazil, and we'll talk about the next minutes on the current challenge that we face when prescribing compression in my country. Actually, this talk was based on a comment that I did send to the CCC Congress, which was a great meeting that we have in August in Germany this year. And in a few weeks, we will meet again in Indonesia for the CCC workshop during the VHelp. So it's important for us to talk about and see different scenarios when we are talking about compression. So more than just my opinion and evidence-based comments, I will present to you guys a survey that I did apply on doctors all around Brazil. I don't know if you know, but Brazil is a big country and we have many different regions with different realities, and we did want to ask those doctors what were the challenges that they face when we are prescribing compression. So we will focus on these next slides on patient adherence, the prescriber knowledge, and also the accessibility that we have. When we talk about the physician's profile of the doctors who did answer this survey, we see that most of them were from the Southeast region, which is no surprise to us, is the most developed one and the one with the most population as well. And the the profile of these doctors who did answer, they were not rookies when we talk about prescribing compression. They did prescribe compression over 10 years. So we wanted to ask them how often do they prescribe compression and what kind. We see that most of them do prescribe them always, 42.4%, or almost always, like quite frequently, like 56.3%. And when we talk about what kind of compression do they prescribe, we see that 99.3% of those doctors do prefer to prescribe almost every time elastic compressions and the use of stockings. And we talk about the other devices that we see less than half of those doctors prescribe the other kinds of devices for compression. So why would that be? Would that be because the Brazilian patients do not need an elastic compression or bandaging or wraps? Or is it because the Brazilian physicians lack the knowledge to do prescribe different kinds of compression? So we will talk about this on the next slides. The main challenge that these doctors say that they do face when they are prescribing compression is the patient compliance. Patients do tend to say that the compression is too hot, too uncomfortable to wear, so they do have a difficult to make the patient comply. It's also very difficult to have the product in some regions in Brazil. For example, I do live in the Northeast region, which is almost up north, so here for us to find some kind of products can be quite hard. We also have as a problem the high cost of the products. So for the patients who do have an income, just so that you have an idea of, in my state, they do live a month with 400 reais, which is the currency that we have there. We have stockings that could go for 500 to 900 reais, which is more than double what the amount that they have of money to live by the whole month. So the cost of the products is definitely an issue that we face here when we are prescribing compression. We also see that the doctors do face a lack of appropriate knowledge on how to prescribe different kinds of compression for different kinds of patients. So this is also a problem that we face. And when we talk about what are the barriers for the patient compliance here, we see that the physicians do say that the patients always complain about the perception of discomfort in hotter climates. We are a tropical country, which a big part of the country is like summer all the time. Where I live, it's summer all the time. Patients do have these misconceptions that when they use stockings, it does increase sweating, although this theory has never been proven in studies, and this do impact a lot on the adherence for the therapy for those patients. We also have a big problem here, which is the financial barrier to access those problems. We go from high cost of the compression problems to the accessibility issues on the poor populations, and we do need to change, if possible, these economic barriers to further reduce the adherence. So just you could have an idea. Here, medical stockings, compression, these products they have the same amount of taxes than designer clothes. So this is a medical problem, a medical product. Why do they have to have so many taxes? It does increase the cost for the patients and the high ending, and it makes it harder for them to get the product and comply with the treatment. So we do see as another problem here in Brazil the knowledge gaps among prescribers who are prescribing compression. They do see that they do complain that they have an inadequate focus compression therapy during training, during residencies. They do tend to complain about difficulties in prescribing inelastic and high compression products, and this does impact directly on the patient outcomes and engagement, as do we know. We see this misalignment between prescription and patient's lifestyle, and this does have the risk of poor adherence, and we do see in most cases suboptimal results on that. And when we did ask those doctors what they thought it was the impact of the lack of information when they are selecting the products, and most of them, 59%, said that the impact is going to be in the results on the patient. And as for what should we do, we see the importance of continuous education. So this is why CCC was so important. This is why this workshop is going to be so important, and meetings like we in Indonesia as well. We have a need for better prescriber education on compression therapy. It's important that they are integrated and know about therapies and also patients' lifestyle to prescribe the right kind of compression to that kind of patient that fits into their lifestyle, that they can know how to use, that they know the importance of using compressions, and it is quite important. And for those doctors, we did ask them how often do they go to get updated on compression or participating in meetings that have compressions, and they do say that they don't participate a lot, but they do wish that they would participate and there were more events on it so they can know more, and that the education on these newer generations, when we are talking about residency and training programs, that it also should be better too. So to conclude my talk, it's important that we address the compliance of the patient, also the financial barriers that we have here in Brazil, and also the knowledge gaps that we have among prescribers is quite essential. It's important that we advocate for continuous education and research on those topics, and we should also advocate for better accessibility and appropriate use of compression therapy. So this was my final remarks. Thank you for your attention and participation, and see you soon in Indonesia. Bye-bye.